Ladies and gentlemen, thank you for standing by and welcome to the MichBusiness Healthcare Review webinar. As a reminder, this conference is being recorded today, Thursday, December 15th, 2016. And I would like to now turn the conference over to Ms. Jennifer Werner. Please go ahead.
Hi, good afternoon, everyone. Thank you for joining us for our webinar today. I'm, again, Jennifer Werner, Vice President of Insurance Operations for MichBusiness. We're pleased to have MacDonald, Director of Small Group Sales and External Distribution with us from Blue Cross Blue Shield of Michigan, our health insurance partner today. Aaron is going to be providing an overview on trends, new offerings, and potential solutions that Blue Cross offers. We wanted to also let you know that we do have an opportunity for you to ask questions during the webinar, but we will be taking the questions at the end of the presentation. So please submit your questions. If you look on the left-hand side of the screen, we will be cataloging those questions and carving out some time at the end of the webinar to ask those questions. If we do run out of time, I would ask that you do email me directly with any questions that we didn't get to. And my email address, if you can make note, is jwerner, spelled W-E-R-N-E-R, at michbusiness.org, M-I-C-H, business spelled out all one word, .org. Or you're welcome to reach me at 586-393-8800. My extension is 166, and we can cover your questions that way as well. So again, I want to thank you all for joining us today. I'm going to turn the reins of the webinar over to Erin, and she's going to walk us through our presentation, and then we'll carve out some time at the end for some questions. And Erin, are we ready?
We're ready. Thank you, Jennifer. So first off, I want to say thank you and acknowledge MichBusiness for hosting today's webinar. One of the things that MichBusiness does for folks throughout the state of Michigan is they're a real advocate for businesses. And part of their advocacy is around making sure that their membership and other companies even that aren't members of MichBusiness are aware of some changes in industries and what are some of the major trends that are going to impact business here in Michigan. And so I'd like to acknowledge that, they were a really strong partner of ours going into the Affordable Care Act. They were one of the major channels that worked with us to help educate businesses throughout Michigan. And so they're continuing to do that for industries throughout our state. And I just want to recognize them and appreciate the opportunity to be with you today. So today, I'm going to focus on a few key themes. And I just want to make sure that everyone understands up front that I'm really addressing healthcare at a very macro level. So I'm taking a look at broad industry trends. What are some of the things impacting cost in our industry? And I know that's probably something that's of acute interest to all the folks on the call, whether you're an insurance agent representing Blue Cross Blue Shield Blue Care Network products as well as other carriers, or if you're a small business or a mid or large size employer who are struggling with things like the cost of health care. We're going to acknowledge some of those cost drivers, and we're going to talk about how they impact the cost of the care. Then we're going to really look at three key trends that I see is trying to impact cost in the industry. And the first one of those is provider networks. And that's things that Blue Cross Blue Shield Blue Care Network and other insurance carriers are doing to impact how care is delivered and how it's paid for when we're interfacing with our provider communities. Next, we're going to talk about emerging technologies. I think we would all acknowledge that the digital evolution in the United States and throughout the world is going at a pace that's really difficult to keep up with. But it also has some really interesting impacts on our industry and things that we can leverage. So we'll talk a little bit about that. And then we'll spend a few moments talking about private exchange. Now, I would acknowledge going into this a couple things. First off, there's a lot more evolution and trends occurring in the industry than what we're identifying today. I'm just picking a few of the key ones that I see. The second thing is I'm a salesperson at Blue Cross Blue Shield. And so it's always difficult to rein in a salesperson and get him or her to do more of an informational type presentation versus a sales presentation. So to my best of my abilities, I'm going to make this an informational presentation, but I will be using some examples on some of the things Blue Cross and Blue Care Network is doing to really reinforce some of the points I'm making. So let's go ahead and jump into the conversation around the cost issue. I think this is probably one of the areas that most of the folks on the phone are struggling with, is the rising cost of healthcare. It's certainly not a new conversation. I think it's something we've been wrestling with for 15, 20 years now in our industry. And it's the reason why there's a lot of regulation that have occurred, like the Affordable Care Act. So one of the things I wanted to do is spend a little time talking about some of the drivers of healthcare cost. I used to have a person I worked for who used to always say, hey, can we stop admiring the issue here a little bit and start working towards solutions? And I've adopted that language oftentimes in some of my conversations with my internal colleagues as we wrestle with issues here within the walls of Blue Cross Blue Shield. However, I think that there is some merit in spending a little bit of time to acknowledge what are some of the cause of these, the cost of healthcare issue. And so we'll spend a little bit of time talking about a few different things. But I did want to say I'm not pointing the finger at any one specific reason why healthcare costs are going up. There's a lot of different reasons, and we're going to explore some of those now. So let's start by talking about some of the issues that could be going on in the provider community. There was a really interesting study done by the Harvard Business Review in 2015 that said when you take a look at the overall cost of healthcare, about 14% of it is driven by clinical waste within the healthcare industry. 9% is administrative complexity. We recognize that delivery of healthcare is not a simple thing, and it shouldn't be a simple thing because people are trusting their lives to the provider community. They need to make sure that they're dotting all the I's and crossing all the T's. However, it's driving a lot of cost. There's excessive pricing, so we will recognize that both within the provider community in more traditional brick and mortar settings where you think of your doctors, your specialist hospitals, but also things like in the pharma world, and we'll explore that a little bit more in a subsequent slide. And then 7% of cost is due to fraud and abuse. So if you take a look at all of this information, you can certainly say, well, a lot of the reason healthcare costs are increasing is because there's all this additional cost built into the provider community that shouldn't be there. However, I think that there's plenty of blame to share around. And so there was a study in 2003 by the New England Journal of Medicine that cited 31% of healthcare spending is due to administrative costs created by insurance carriers like Blue Cross Blue Shield and Blue Care Network. So this is pointing a finger a little bit in the mirror and saying, yes, we have some culpability in the cost. I think that this number is probably a little high, and the study is obviously 13 years old, but there really hasn't been a real comprehensive study since then that tried to answer this question. And I think we could certainly acknowledge that it isn't easy for providers to work in the environment they're in, working with multiple carriers, whether it's the Blues or our competitors, because we all have different forms, we all have different processes, we all have different inquiry units, et cetera. So for providers, they're spending more time here, an inordinate amount of time, trying to get their bills paid than they would be comfortable doing in a setting that they would be setting up from scratch. 69% increase in individual premiums from 2013 to 2015. So one of the things that was obviously a very hot topic this election season was the cost of health care. And you look at this Forbes study from 2016 citing that 69% increase in individual premium cost, and you think, wow, the government is creating a lot of additional cost in the industry. I would note that this isn't really fair, that yes, that's true, 69% increase. When you look at this is a national average, it's not specific to Michigan, but there's also richer benefits in the individual market. There's changes in the approach to underwriting, and now that there is guaranteed issue, anybody can go out and buy an individual policy, where in the past a lot of insurance companies would actually exclude coverage from the sickest individuals. So when you increase the access to the individual market, and you also improve the benefits delivered in the individual market, you would expect pretty big increases. But nonetheless, you could point the finger at the government and say, yeah, there's a lot of stuff that they're introducing in terms of regulation, whether it's the Affordable Care Act on a national level, or here within the state, there's required benefits that insurance carriers must offer based on state mandates, that there is some culpability in the government for the increasing cost of health care. The next place you could point at is the legal industry, and this was, again, a hot topic during the election season. So, one of the things I think is primarily a platform on the right side of the aisle is tort reform as it relates to the medical industry. So there's a really good study in 2010 from Harvard School of Public Health saying that about 2.4% or $55.6 billion of cost in the health insurance world or healthcare world is due to the impact of medical liability. And that includes malpractice insurance that all providers must purchase, but it also includes defensive medicine. So one of the things that we recognize is a lot of providers are prescribing more tests than they need to. They're performing more tests within the office setting because they're concerned about potential liability if they don't end up doing one of those things and they find out that they should have and there's an emerging illness, injury, et cetera, due to lack of prescribing those additional tests and sorts. So this does have some impact on the industry, but as you can see, it's a little bit smaller impact than some of the other ones that we're looking at. It's the drug industry's fault, and this is, again, a real hot topic. It picked up some speed in the election season, but even prior to the election season, there was a lot of big news stories around the cost of prescription drugs and some of the issues that are emerging in this industry. And so I'm citing one. I think another great example would be the Hep C drug innovations over the past 24 months, which come with price tags of around $100,000 for treatment. But one of the ones that had a lot of attention about a few months ago that I thought would be interesting to point out here was what's going on with EpiPens. So most of you probably are familiar with EpiPens. EpiPens are a delivery device for epinephrine. It's primarily for folks with severe allergies. They're life-saving devices. If your son or daughter has a peanut allergy and a severe peanut allergy that could even lead to death, you use the EpiPen to deliver epinephrine, and then they get through the asthmatic episode. So real important tool for folks out there that have severe allergies. So if you take a look at the cost of EpiPens, they've increased 600% from 2009 to 2016. During that time, the cost of the actual drug delivered by EpiPens has stayed around $1. So the actual cost of the drug is very inexpensive, but the delivery system for that drug has increased significantly. Incidentally, 2009 was the year that the company who created EpiPens was bought by another drug manufacturer. So I don't think there's probably coincidence there. This was a play by that manufacturer to make a lot more additional money on an existing solution. So some significant concerns in the drug industry, and I think we'd all acknowledge that drug pricing, particularly due to specialty drugs, is increasing significantly. It's medical technology's fault. Well, it's kind of tough to point a finger at things that are saving lives, but nonetheless, we are advancing our technologies, and the medical industry is very unique. Normally, when technology advances in an industry, it also comes with efficiency. So if you think about the auto industry, when they're investing in technologies, generally they're saving cost, right? They're introducing more robotics, et cetera, which is allowing them to save on full-time employees. But that's not true of the healthcare industry. Healthcare industry, when technology is increased, generally it comes at a higher price tag. And so over the past 15 to 20 years, we've seen a lot of fantastic new solutions and technologies enter the healthcare world, but unfortunately, those come with a higher price tag. Robert Wood Johnson estimates that at 38 to 65%. Obviously, this is a very broad range, but it's kind of difficult to put an absolute number on how much technology is increasing the cost, and so I think this is probably a good talking point and estimate for us to move forward. 26% of healthcare cost is our fault. And so again, this is something that gets a lot of attention. Journal of Occupational Environmental Medicine in 2015 published this study saying 26% of healthcare costs can be attributed to modifiable lifestyle decisions. So that's folks that have a BMI that higher than it should be. It's smoking. It's drinking too much. It's not getting enough exercise. All those things that we hear we need to do more of and better of, but recognize as a society we're really not progressing is absolutely affecting the cost of health care. So when you take a look at all of those different contributors to the cost of health care, what we recognize is it's having a huge impact on our employer partners that are offering coverage, individuals who are buying individual products. In total, healthcare cost has gone up in the last 10 years from 2005 to 2015, 61%. 54% of that has been felt by employers, and 83% of it has felt by employees. And this is reflective of employers passing on more cost to their employees over the past 10 years, as they simply can't keep up with the rising cost of health care. And the problem with this is those aren't all interdependent things. They're all entwined. And so it's kind of like one of those great big knots. It's really difficult to find a place to start unraveling it. They are all intertwined. And in order to really solve the healthcare problem, the healthcare cost issue, you have to start tackling on so many different fronts. And being able to mobilize our government or even insurance carriers all to agree on an approach, it's very difficult to do. We have very different views on a lot of these topics. So on the left side of the aisle might feel like this is where we should spend our time. The right side of the aisle feels like this is where I should spend, or this is where we should spend a lot of our time. Then a lot of people are saying, well, the left or the right side of the aisle shouldn't be figuring any of this. This should all be determined and figured out by the private sector. So, a lot of people, a lot of different opinions, a lot of different stakeholders, not easy to manage. So what are some of the key things that are occurring in the industry that are out there trying to impact the cost of healthcare? And one of the first places I want to point a finger to is provider network evolution. So one of the things as an insurance carrier we recognize is that if the costs continue to rise to exponential levels, there becomes a tipping point where maybe we don't have a spot in the value chain anymore. We need to make sure that we're continuing to prove our value proposition to market, to our employers who count on us for coverage, our individual subscribers who count on us for coverage. They're relying on us to manage cost. And one of the first places we're looking at is how can we work better with our provider partners to help keep costs down. So I want to start by talking about a little bit around what we're doing in the provider space, and then I'll talk about how the rubber hits the roads for employers out there. So both at Blue Cross Blue Shield and throughout the healthcare industry or health insurance industry, you're seeing a major shift from fee-for-service to a value-based approach to payment of providers. Now, what does that mean? I mean, I think if you at all follow the industry, you're familiar with fee-for-service. You've heard that term before. You may have heard value-based. It's getting a lot of attention over the past few years. But what does that really mean? Well, in a traditional fee-for-service model, every single time a provider renders a service, that provider is paid for that service. So, for example, if MacDonald has a rash, and I decide that I'm going to go to my primary care physician and get that rash taken care of. I go in there the first time, it's misdiagnosed. I go in a second time, it's misdiagnosed. I go in a third time, and it's fixed. That provider is getting paid 3 times in a traditional fee-for-service model. In a value-based model, what you're looking at is episodes of care where that exact same example, we're saying, okay, provider, we're going to pay for MacDonald's treatment of his rash. Gosh, I wish I wouldn't have used that example. I don't like to keep saying MacDonald's rash. But nonetheless, we're going to pay for that treatment. But we're not going to pay you if it takes you 3 or 4 times, 3 or 4 different payments to take care of that same condition. You need to spend the time with that individual to diagnose it appropriately the first time, to prescribe the appropriate medication or solution to that issue, and you'll get one payment. Now, we might be willing to pay a little bit more, but we're not going to continuously pay you for each time that there's a service rendered. That's a very simplistic view of the difference between fee-for-service versus a value-based approach, but I think it does a really good job of making the point and moving us forward in the conversation. So with that in mind, Blue Cross Blue Shield has developed a number of different programs. Now, this is where I step back and say, okay, I'm not trying to do a sales job on any of the folks on the phone. I think Blue Cross and Blue Care Network do a really good job of helping manage our network. I think that we're an innovator in many different ways. But that being said, I would acknowledge that most providers are trying to find ways to work differently with their network of providers and make sure that they're introducing programs like the ones I'll describe here shortly to keep costs down, to deliver care in a smarter way. So here are 9 programs that we've implemented at Blue Cross, Blue Shield, and Blue Care Network. I'm not going to describe each and every one of them in vivid detail. However, I'll just highlight a few of them. So the first one is the Physician Group Incentive Program. So one of the things that we want to do is pay our providers for quality of care. And so rather than, again, treating it in a true fee-for-service format whereby we're paying them each time care is delivered, we're starting to set aside dollars, or have been actually it's been about 12 to 13 years now, where we'll actually create incentive programs for provider groups who are performing better than their peers. So one of the things I don't think is very well known is that we actually haven't increased the fee schedule to our provider partners since 2009. So 7 years we haven't increased the fee schedule for our provider partners. However, over the course of the last 7 years, we've been putting more and more money aside into this incentive program, whereby we're rewarding providers who are providing high-quality care in comparison with their peers. Patient-centered medical home was something that we introduced to market about 10 years ago. We were the first of its kind in the nation, and the idea behind this is we want to help our primary care physicians deliver care in a better way. And so we created a whole bunch of criteria for a primary care physician to be part of our patient-centered medical home. Those included more access to the provider, so longer times with the provider when you go in to visit him or her. It means more access to his or her office, so our patient-centered medical home physicians have off hours where you can still get a hold of them, and a whole host of other things. If a provider does that, we'll actually pay them more for our members who go to see them, and we expect that there are better outcomes for those members. And you're going to see in a subsequent slide, we have some really good statistics that actually supports that. In addition, we're going to provide those providers with more insight around their patient population so that they have a more comprehensive and holistic view of those patients and can make smarter decisions when they're delivering care. Patient-centered medical home neighborhood basically takes some of the same concepts we learned in the patient-centered medical home with our primary care physicians and introduces it to our specialists that work in our network. And then organized systems of care I want to highlight because we're going to talk about a product in a short while that actually utilizes our organized systems of care. And what the organized systems of care does is actually tries to take primary care physicians, specialists, and hospitals and really change the way that they are integrated and change the way that they communicate with each other. And we feel like when we can do that, we're going to end up improving the quality of care that is being delivered from that primary care physician, that specialist that he or she is working with, and the hospital that the two of them would end up admitting into. So lots of work in that space to improve quality of care. So the question is, are we seeing outcomes based on these provider models? And the answer is yes. We're seeing really good outcomes. One of the programs I didn't highlight on the previous slide is Blue Distinction Specialty Care Centers. These are hospitals that we've designated as performing better than their peers in one of 6 different categories, or all, depending on the specific facility. We have bariatric surgery, cardiac care, knee and hip, maternity care, spine surgery, and transplants. And when you take a look at the facilities that we've designated as Blue Distinction Specialty Care, you can see they're having better outcomes. Let's take bariatric surgery, for example. 26% lower readmission rate. So if somebody goes in and gets bariatric surgery at one of our Blue Distinction centers, they're 26% less likely to have to go back for follow-up care. 31% lower complication rates. And when you're improving quality, you're normally improving cost. And you can see that for our employer partners, this is a 13% savings in cost based on these facilities performing better than their peers with these 6 different types of procedures. I talked about patient-centered medical home. So we're seeing the results from our patient-centered medical home designated physicians. If we take a look at the membership that's attributed to the patient-centered medical home doctors, 11% fewer emergency rooms in total than non-designated physician peers. So if you can compare a provider who's in the patient-centered medical home, you can expect that the patients he or she sees 11% less likely to go see an ER than a non-primary or non-patient-centered medical home primary care physician. Almost 13% primary care sensitive emergency room visits. So these are procedures that are specifically procedures that could have been rendered in the primary care center but are delivered in the emergency room setting instead. And then 26% fewer ambulatory care sensitive inpatient discharges. So these are admissions into the hospital for things that could have been prevented at the primary care level. You can see much significantly lower discharges for the patients who are attributed to patient-centered medical home doctors. So really good results coming out of a couple of these programs, and we have examples for all 9 of those that I cited a couple slides ago. I just wanted to spend a moment or two citing, again, some of the results we've seen from a couple of the key programs. So where does the rubber hit the road for employers? So one of the products that we've introduced is Personal Choice PPO, and that's a relatively new product to market. It came out in October of this year. Wanted to stop before I get into a discussion around that Personal Choice program and acknowledge when you have all this provider innovation, like the ones I just described, like some of the stuff I just described, the question for us as an insurance carrier is, how do we take that provider network evolution and deliver it to market so that our members, the ones who are actually holding a card, are actually seeing the physicians and the facilities, et cetera, that we've designated as high quality and or low cost. So the answer to that is you have to start productizing it, right? You have to start creating incentives for them to go to those types of physicians and hospitals. So the best way to do that, or the easiest way, particularly for smaller and mid-sized clients, is to create products around it. There's really 2 types of products you can deliver to market as an insurance carrier that reward folks for seeing your high-performing physicians. The first is a tier network product, and the premise behind a tier network is that we are going to absolutely incentivize our members to use our high-performing physicians. However, if they want to go and see other physicians, they can. It generally will be at a higher cost. The second approach is narrow network, which is basically saying the only place we're going to deliver care to those members is at our high-performing physician offices and facilities, specialists, et cetera. So the product I'm going to describe to you now is one of our tiered network products, but I would acknowledge at the Blues we have both, a tiered network and a narrow network. But the reason I think it's important to step back and make sure those terms are defined is lots of times you hear them used interchangeably in the industry, and they simply aren't the same thing. Tiered network, you have an incentive to see high-performing docs but can still see anybody else. Narrow network, you really have to only see the physicians in the narrow network. Back to Personal Choice. So Personal Choice is a tiered network product we're delivering on the PPO platform now at the Blues. And the idea behind it is we are going to create 3 different benefit levels. We're going to create a benefit level for seeing our high-performing organized systems of care. And remember, I introduced that term a few slides ago. Organized systems of care is a program whereby we're connecting primary care physicians, specialists, and hospitals, all of whom are going to be trying to holistically treat a member. And so we take a look at all those organized systems of care that we've helped develop throughout the state, and then we make a determination which ones are doing at the lowest cost. So we know that they're all high quality. Some of them do it at a lower cost, and we put them in a Tier 1 benefit level. We design deductibles and coinsurance, copays at the lowest level if our members go and see the high-performing, low-cost organized systems of care. However, again, this is a tiered network product. So if somebody doesn't want to see one of those high-performing level 1 organized systems of care, they can still see other organized systems of care, folks in the traditional PPO network. They'll do so at a little bit higher cost, but you still have full access there. And then if you have a member who wants to see somebody that doesn't have any relationship with the Blues, he or she could still do that by going outside of the network. So a sample plan design can be is shown here on this slide, which is this is an example personal choice product. You have a level 1 level of benefits. You can see we have the lowest deductible in that level of benefits. We have lowest coinsurance, lowest flat dollar copays for office visits, specialists, etc. Level 2 is, again, that traditional PPO network that we're all accustomed to, but a little higher deductible and coinsurance and flat dollar copays. And then you still have the out-of-network benefits, where most services are covered, but it'll be covered at deductible and coinsurance at a much higher level. So this is a really good example of how you can take those narrow networks, or take those high-performing networks, I should say, and create a product around those, which will reduce cost for customers. So the cost of this product is anywhere between 2 to 9% lower than a traditional PPO product, depending on a group size and what the product, which product they're choosing. So you can start to impact cost by delivering these types of solutions in the marketplace. And it's also obviously a great way for us to really try to push some more membership and patients towards our high-performing providers. Question is, how quick are they going to gain in popularity? So there's been a lot of conversation around high-performing networks over the past couple of years. Kaiser did a really good study last year showing the amount of adoption. You can see from smaller firms with 3 to 49 workers, about 17% adoption, up to firms with 1,000 to 5,000 workers at about 33%. So you can see that there is starting to be some pretty good adoption, and we expect the adoption will continue to increase. If you take a look at an Aon survey back in 2015, they asked employers how likely they were to start offering narrow network products or high-performing networks. And you can see that in the next 3 to 5 years, it looks like there's a lot of employers who are seriously considering this as part of their health benefit strategy moving forward. So I think we're going to see some considerable adoption over the next few years of narrow networks in our industry. Okay, so now I'm going to pivot from our conversation around network innovation. Again, wanted to outline some of the things that we're doing in the network space, talk about how you productize some of that network innovation to deliver new and innovative, lower-cost solutions to marketplace, to talk about emerging technologies. So as I discussed on the agenda slide, one of the things I think we all recognize is digital technology is moving at such a rapid pace, it's very difficult to keep up with. But it does have some really exciting implications in the healthcare world. And so right now we want to talk a little bit about what some of those innovations are. What is it that the Blues are doing and other carriers? And again, I'm trying to be carrier agnostic here. I think one of the things I would acknowledge is a lot of this that I'm going to talk about in terms of the digital space isn't unique to us. A lot of carriers are trying to evolve as digital technology evolves. So I want to talk a little bit about the push towards digital, though. Let's set some groundwork before we start talking about some of the tools and solutions you're starting to see delivered in the marketplace. I think this slide does a really nice job of showing you some really interesting statistics around how things are moving to digital. So first point here on this slide, 51% of emails are opened on a smartphone today. You compare that with 10 years ago where we were all interfacing with our email through laptops and desktops. It's just amazing how quickly that's evolved. 98% of text messages are opened versus 22% of email. So you think about how people are preferring to get their information, that real-time delivery to a text message base versus email, which we all have to go in and capture and bring back. Obviously, some huge opportunities here for us. People spend 14 more times on their mobile device versus their desktop or laptop computers, and then 90% of folks move between devices to complete a task. So I might send an email from my desktop computer, and then an hour later I get a response, and I'm on my mobile device, and I then reply to that response through my mobile device. So we're all using a variety of technologies to interface with our stakeholders on a day-to-day basis. So question is, how do carriers like Blue Cross Blue Shield and Blue Care Network start to utilize some of these technologies to change the way we're delivering care or change the way that we're working with our membership? So in terms of care delivery, I wanted to highlight online care. So this is something that the Blues delivered over the course of 2016 to all of our customers. I think, again, would acknowledge that most carriers are now investing in this space, at least carriers of any significant size, are now offering telehealth or online health. So a couple of things about it is, first off, we know that there is a demand for it. Based on a Harris poll, there was a nationwide poll, 64% of consumers wanted to have or willing to have a video visit with a doctor. And so we know that there is an appetite for this. And so I think issue that we've had, or that we see in the industry, not specifically to the Blues, is adoption of it. And so the key thing is not only to introduce the solution, it's to make sure that the membership understands it. It's obviously not going to be used for all levels of care. This is not meant for urgent or emergent care. If I have a severe injury or something of that nature, I'm probably not calling into a telehealth line or having an online visit with a board-certified doctor. However, if I have a non-urgent type care, this is a really great benefit to me. So, and I have a really good example of how my family actually used this benefit. This summer, we were actually up north on vacation, and my son was out swimming, and he came out of the water, and he was complaining about his foot. He had a lot of pain in his foot. And so we took a look at it, and sure enough, he had, well, it looked like a kind of a growth on his foot. And my wife and I had no idea what it was, and you could tell he was in a lot of pain. And it was 4th of July weekend. We knew that we weren't going to get in to see an actual conventional doctor. We'd have to go into an emergency room. We kind of felt like that wouldn't have been a good use of our time or dollars to go in an emergency room, because we just assumed it wasn't life-threatening. It didn't seem like that. So we actually used the online healthcare benefit, actually called in, talked to a doctor. It was about 7 o'clock at night or so, or 6 o'clock at night on a Saturday. Doctor took one look and said, your son has a plantar's wart. And so this is a great example of how you can use this type of technology and change the way care is delivered. You can actually meet people where they are on their phone with care delivery today, and we think that that's a pretty exciting innovation. When you take a look at our digital approach, and I think it's probably, again, representative of most insurance carriers, we have 4 key pillars, 4 key things that we're trying to do. One is we're trying to help our members manage their plan better. 2, we're trying to help our members shop for care in a smarter way. 3, we're trying to help our members get well or stay well. And then lastly, we're trying to help them get care through things like online care delivery, which I just presented to you. So, a couple things about each one of these. In terms of helping folks manage care, you can do that in a variety of ways, but one of the ways I think a lot of carriers are doing, including us, is through our app or through other digital types means of reaching out to your members. If you take a look at the Blue Cross Blue Shield app, there's a number of things out there that they can do, our members can do. They can check coverage, they can view a virtual ID card, they can review claims, they can look at their status in terms of deductibles and out-of-pockets, a whole bunch of stuff. I don't need to read it all to you. And we're going to continue to evolve those types of technology. So this is going to allow our members to manage care a lot smarter. It's going to mean that when they walk into the doctor's office, they can pull up their information and understand, again, how much they've paid over the course of the year in deductible. They can take a look at what types of prescription drugs have I been issued lately. I know lots of times when I go into my doctor, he or she will ask, what drugs are you on? And sometimes I know what the drug is on to treat. I know the issue that I have, but I might not remember the actual name of the drug, and I can look all that up. So again, this is all stuff that will help our members manage their care better and also help them understand their care better, which we know in the healthcare industry is really important. A member who understands their coverage likes their coverage a lot more. And that's important to employers as well, because you can offer a high deductible program, but if your employees understand it, they'll still be appreciative of that product. If they don't understand that product, they can end up resenting you for the product that you're delivering to them. So helping members understand their products is really important, and we're doing that through the digital space. One of the key areas we're investing a lot in, and you see a lot of carriers doing this as well, is in transparency. And this gets a lot of attention in the industry. That word is certainly a buzzword in health insurance, and that's transparency and helping people understand the cost of care. One of the things, before we get into the discussion around that, I wanted to show you is this Castlight study from 2016. Castlight's an organization whose really sole purpose is around providing transparency on cost and health insurance. They did a really great study this year around the cost of both natural and cesarean births in a variety of metropolitan areas. They picked 30 of the most populous U.S. cities, and they basically said, what is the minimum cost, or what's the lowest cost in those areas, and what's the highest cost, and what's the variance? You take a look at Detroit, and we were the 21st in terms of populous cities. The smallest cost for a cesarean birth was $3,600 in the Detroit area. The highest was $12,966. So that's a 4 times variance in cost. Those variance in cost are really important to individuals with high deductibles, and particularly those with health savings accounts, who are really on the hook for the full cost of their care. And so one of the things that we want to do is invest in technologies to help our members get a really good insight in terms of these varieties of cost. So if you take a look at what we're doing, and this is again reflective of what a lot of carriers are doing, is we're investing in technology to help them understand cost. So you can go out to the mobile app and get some of our cost estimates. You can go to our website, and you can see the screenshot I have here is actually a website screenshot. And you can see this person is looking for the cost of knee replacement. They put in their location, and it comes back and gives the average total cost for that knee replacement in a variety of different health systems. Here we're highlighting Mercy Health and Spectrum, but if we were able to scroll down, you'd see that we have a lot of other health systems as well within a prescribed range from where the subscriber is located. So, this will really give you the opportunity as a subscriber to go out and shop. And while some of these big ticket items like knee replacement may not have a huge impact on my deductibles and coinsurance, because I probably am going to max those out regardless of where I go. For more mid-range costs and low-range costs, this could have a significant impact. And so you're seeing a really big investment into transparency technologies. Not only are we doing that in the medical space, we're also doing it in the pharmacy space. And if you haven't ever done this, I encourage anybody on the phone to do this. If you have a prescription drug that you need to get filled, call around in your area, particularly if you're in an urban area where you have access to a whole bunch of different pharmacies. What you will find is staggering difference in cost from one pharmacy to another. Even sometimes when pharmacies are the same company, like so you call one CVS that's close by and another one that's 5 miles down the road, you can find different prices at those two different that same pharmacy chain, but different pharmacy locations. There's huge variety of variance in cost from pharmacy to pharmacy. So one of the things we want to do is provide insight in terms of those pharmacy costs. So we've continued to build out tools that will allow our members to go out and actually do the same things on the pharmacy side that I just showed you on the medical side, which is let's get some cost estimates based on some pharmacies in my location. So where does this all lead? So this is all kind of interesting stuff. We understand that technology is emerging, but what does this mean in terms of products and other things? On the kind of small side, I would say we're going to start seeing more and more employers and more carriers develop programs that are rewarding members for going out and doing some kind of consumer shopping around around different treatments. You can't do it, of course, for all treatments. If I'm having emergency care, I'm not going to have the opportunity to go shop. But if I'm shopping something like a diagnostic, like a CAT scan or a MRI, that's an opportunity for me to shop. If I'm shopping for things like elective surgery, opportunity to shop, right? So you're going to see a lot more push towards incentivizing members to go out and shop and find the most appropriate physicians at the right cost. On the more extreme end, I just wanted to give you a quick presentation or a quick slide around reference-based benefits. This is taking all the stuff that's occurring in the transparency space and really productizing it in a new way, in an innovative way. It's a way that primarily, though, I think it will only find adoption in the key and large group world. So we're talking about 1,000+ groups that are self-funded. Difficult to introduce these solutions to the fully insured market. There's a lot of regulation there. But we're starting to see some really large employers introduce reference-based benefits whereby they're going to set a price that they're going to pay for certain procedures. And if a member wants to go to a place at that price or lower, then they're going to pay their deductibles and coinsurance. If they want to go someplace with a higher price, they're going to pay their deductible and coinsurance, but they're also going to pay for any difference between the reference price that the employer has set and the cost that's administered at the location the employee chose. So, I think this is kind of an extreme end to transparency, but it's the ideas and concepts around this probably will continue to get integrated into downsized markets as more and more employers are concerned that their employees are not really doing due diligence and shopping for services and helping keep costs down. Okay, and the last place I want to spend just a few moments on, and then we'll have time for some questions, is private exchange. So I would say, I've talked about buzzwords in the industry a few times now. Probably there's few that have gotten as much attention as private exchange over the past 4 or 5 years. So let's talk a little bit about what it is. This will be very high level, I think. Based on looking at the folks who are joining the call, most of you probably have a pretty good understanding of this. But then we'll talk about potential adoption. So I think when I think about private exchange, the individual elements of private exchange, none of them are really new to the industry. You have selecting a benefits menu. Well, you have employers been doing that for years, particularly mid-size employers or employers over 10 in size. Lots of them are offering at least 2 products. So you have an employer who's choosing a product for the employees. The only difference and tweak here in the private exchange world is generally you're creating a bigger product menu for your employees than just 2 or 3 or 4. Generally, you're offering upwards of 10 different products depending on the size of the employer. But you are setting a menu of products. Next, as an employer, you're establishing a budget, right? You're setting aside X number of dollars that you have determined that your employees can go out and spend. Third, you're allocating funds. So you're depositing on a pre-tax basis into some kind of account for your employees to then go out and choose benefits, right? So then they go out and they go out, just like in today's world, they choose which product is going to work best. Now, what makes a private exchange a bit unique is you take all these different elements and you wrap it up into a benefit administration platform. So you create an online experience for that member where they're going out, they're looking at that menu of products that you've selected, they're seeing the dollar amount that you've set aside, and then they're taking those dollars and shopping for the right product, generally with some kind of decision support tools. Those are questions that help them figure out what the product might be that best fits them and their lifestyle needs. So that, in a nutshell, is private exchange. I'm not spending a whole ton of time on it for today's presentation because I think there's been a lot of industry presentations and other information out there about how private exchanges work and what they are. But I did want to talk a little bit about adoption rate. So I think this is one of the areas of interest is the question around how quickly are they going to take off. There's been a lot of conversation around private exchanges over the past 5, 6, 7 years. How quickly are they currently growing and what do we project in the future? So you can take a look at, this is a national figure here. 2016, estimated about by the end of this year, we'll probably have 12 million or so Americans covered in a private exchange. But by the end of 2018, a lot of the analysis is showing upwards of 40 million. And this is kind of a number that you see from a lot of different sources as they're estimating private exchange growth. When we take a look at private exchange growth and we compare it against other industries that have emerged, and the 2 that we're citing here in this example is 401ks, and the second is consumer-driven health plans, or HSAs. You can see if you took a same 4-year period what the growth rate was of each of those industries. So for CDHP, or health savings accounts, by the end of 4 years, they only had about 7 million Americans in HSAs. Now, mind you, I think today, now that they've been out for 13 years or so, a lot bigger number there. But it was a slow adoption rate up front. 401ks, kind of similar thing, a little bit better than HSAs, but certainly lower than where industry experts are estimating private exchange growth to be. Truth is probably somewhere in the middle, right? Could be we're up to as high as 40 million lives by 2018. Could be as low as 7 million. Could be as low as 15 20 million by the end of 2018. None of us have a crystal ball, but I think this gives some perspective of that growth rate and how it compares with other industries. And we recognize there's things that could accelerate growth of private exchange, including increasing medical costs, economic downturn. Cadillac tax looks like that's probably going to go away considering our recent election results. Potential decelerators would be unfavorable cost trends that we're seeing in private exchanges. So far, I would say that most private exchanges are actually coming out and saying that cost trend is lower than outside of private exchange, but you never know. If employers start dropping the public exchanges, we saw some smaller employers drop back in 2014 and 15. That certainly has decelerated, but if that was to amplify again, maybe we'd see less private exchange growth. And then lastly, federal elections and regulatory change. So we don't know what the Trump administration and a Republican-led House and Senate is going to do. Certainly a lot of the actions they take could end up impacting how rapidly private exchanges are adopted. So to kind of wrap up the actual content portion of the presentation and move to Q&A, hopefully what you saw is kind of an overview of what are some of the major cost drivers of the industry. So where are some of the things that are increasing the healthcare spend? Hopefully, when you understand those things, at least it becomes easier to articulate that to your employees, or if you're an agent, to your customers. Or second, though, I wanted to talk about, well, what are some things we're doing? Are we just stepping back and raising our hands and saying, costs are going to go up no matter what? And the answer there is no. I mean, we're doing things in the network space. We're doing things in digital space. Private exchange technology is emerging. You could look at wellness. That's something we didn't discuss today, and a whole host of other things. But there's a lot of innovation in the industry that are attempting to tackle that cost. And so I'll stop there and say thank you all for attending. We now have the opportunity to ask some questions, and I'll look to our friends at MichBusiness and Jennifer Werner to see if there's any questions that have already emerged.
Erin, thank you. Thank you so much for covering all of this information in great detail, as you usually do. We really appreciate the opportunity to work with you on this and provide this webinar and all of these concepts and trends and data to our folks on the webinar with us today. So thank you again for that. I also wanted to just kind of go through a few questions that we have received, and just as a indicator, as Erin said, you do have the ability to submit your questions. We have about 9 minutes left for questions, so do go ahead and submit those via the chat, and we'll go ahead and go through those questions with Erin now. So the first one I had was from Ellen Brown, and she's indicating here, how has the provider community reacted to contracting as a high-performing cost? And a follow-up to that is, why would a physician want to be a part of this network?
Yeah, that's a really good question. So, I would say by and large, most providers have been very positive with some of the changes in the industry. And part of the reason is that one of the things that we're doing is they enter things like our patient-centered medical home, as they're going into our organized systems of care, is we're either driving more care in their direction, or we're increasing the amount of reimbursement to those folks on a per-case basis, not necessarily on a holistic basis as you might see with fee-for-service. But for the provider community, they've been looking for this level of innovation. And I'll cite patient-centered medical home. So one of the things that we do with patient-centered medical home is, if we attribute a patient to a patient-centered medical home doctor, we're providing that physician with a more holistic view of that patient. We'll make sure that that doctor, that primary care physician, understands all the different prescription drugs that patient is taking, because that patient might be seeing a specialist who is prescribing a medication that the primary care physician has no line of sight on it. So we'll provide that kind of information to the physicians, and the physicians have been really hungry for that kind of data, because they don't have oftentimes a full line of sight on the overall health of their patients. And so when they go into these programs and they start getting that information, they feel like they have more tools to do their job, and they can do their job smarter. So what we've seen is there's a strong appetite for physicians to get into things like our organized systems of care and our provider or patient-centered medical home, and a number of the different programs we described.
Okay, thank you. The next question I had was actually from Michael O'Grady, and he's asking, does the CastLight tool take into consideration the Blue Cross Blue Shield allowable or provider charges? And then a follow-up to that is, if provider charges, how does this help the consumer?
Well, so, I don't want to speak to the Caslight tool specifically. So the Caslight's their own organization. For our very largest customers, we do have some programs in place where we'll work closely with Caslight. And, the details around that, I think, are a little bit deeper than we have time to get to in this Q&A. I would say that if you're citing specifically the study around cost of birth, that isn't around charges. That's the allowed amount. We do have different allowed amounts at different facilities. If you take a look at the slide where I highlighted the knee replacement and the transparency tool, we negotiate different allowed amounts with different facilities, so they each have different ones. So there is a shopping opportunity there to see where the lowest cost is. And I'm not sure I fully answered that, but to the question, the person who asked the question, please feel free to contact me directly, and I'd be happy to answer that for you. It's AMacDonald, amacdonald@bcbsm.com.
Okay, Erin, we have another question. Is Blue Cross Blue Shield introducing a reference-based product or merely interfacing with a third party brought to the table by the client? And if it's the latter, who is Blue Cross willing to interface with?
Yeah, and again, I apologize because I think we have the same individual asking this question. I think it's a level of detail that we don't really have time to get into a ton of specifics around. But so Blue Cross Blue Shield has introduced a reference-based benefit product. It is right now for our key and large group market, so it's, again, 1,000-plus customers, and there's some other nuances around that. But we do have a product for our largest customers where we're seeing the strongest appetite. We haven't heard a lot of appetite from the mid and smaller markets for reference-based benefits. I would say that I kind of showed that slide just to show like what a really extreme end state of transparency could be, and that's to me that's embodied by reference-based benefits, whereby you are absolutely on a number of services putting a line in the sand and saying we won't pay more than this, and you have to shop if you don't want to get balanced billed. So certainly we're seeing some adoption of that. We have some of our larger clients that are going into our reference-based benefits product in 2017. So we do have a product in this space. I don't expect it to really be in the mid or small markets for a long time, if ever. As I noted when I presented that particular slide, you really have to be a self-funded customer to offer a reference-based benefit product. The regulations for a fully insured group, there's really not an easy path to offer that type of product to a fully insured group. So that's part of the reason I don't see it finding its way into the small group market particularly, but even in the mid-group market where a lot of those groups are still fully insured.
Okay, thank you for doing some clarification on that for us. Another question I had actually was just kind of picking your brain a little bit on other market trends that you may be seeing that maybe we didn't cover today. So maybe doing some forecasting on some things that might be coming up or that we're hearing about, and just some feedback on that perhaps.
Yeah, I mean, and I noted at the beginning of my presentation, Jennifer, I appreciate the question. It's, in a 45 and 50-minute presentation, it's really difficult to talk about everything in the industry, and there certainly is a lot of innovation that's occurring, and I think it's a pretty exciting time to be in healthcare. One of the areas that I think is kind of a big gap in this particular presentation is wellness. There's a whole bunch going on in that space, but I kind of made the decision there that there's been a lot of material, information, webinars, et cetera, around wellness, and so I kind of use this as an opportunity maybe to focus on some things that haven't gotten as much attention. To the other piece of your question is like, what's kind of emerging. I think at the Blues, as well as a lot of folks on the phone, one of the most interesting thing will be around some of the changes that we may see in the Affordable Care Act in the next 6 to 24 months, as a Republican-led federal government is making decisions about, is the Affordable Care Act going to stay in place? If so, what portions of it? Are we going to repeal it in total? Are we going to just change? To us, it's really interesting to see where this conversation leads and what new opportunities might emerge. And, a good example of that is, in a lot of the Republican talking points, health savings accounts are going to maybe take a bigger role in their approach to care delivery moving forward. So that could end up creating some new opportunities or for new innovation in that space that we're not seeing today. So I think the environment's rapidly changing. We're in an ecosystem where almost on a daily basis. It's difficult sometimes to keep up with the innovation, but it's also an exciting time to be here.
All right. Well, I do appreciate that. Aaron, we have had a few other requests for copies of your presentation, so I'll sidebar with you on that. The way that we typically send out our webinar communications are usually a combination of the slides and audio presentations. So the webinar has been recorded, so for those of you that are submitting that question, please know that we will be sending out a copy of the presentation with the audio as a link to all of our attendees today. As far as a copy of just the slide presentation, I'll connect with Aaron and discuss that with him. But I just wanted to answer that question while I have you on the line here, Aaron. The last part is really just to, once again, thank you. I think we've handled all of the questions that were submitted. Again, if anybody does have a question that they want to attend or ask after the webinar here, please reach out to me, Jennifer Warner at MichBusiness, and I will be more than happy to help out and get the answers to you. So Aaron, I want to say thank you once again for your time today. I think it was a lot of great content. We appreciate you putting all of this together for us, and I guess I'll leave it with happy holidays to everybody. So any final parting words, Aaron?
No, thank you, Jennifer. Happy holidays, and again, thanks to MichBusiness for all the great things you do for employers throughout Michigan and beyond.
Thank you, Aaron. We really appreciate it. Everybody have a great day. Take care.